Good evening. This is Dr. Thomas Klein. As you know by now, I'm from Raleigh, North Carolina, and we're having a little thunderstorm today, so hopefully the electricity to the camera will stay. And the National Pain Council is working diligently. We are working with 35 projects currently, and anybody wants a copy of things we're working on, you can just email us at nationalpaincouncil@gmail.com. So today we want to talk about something that's extremely important. This is going to revolutionize 100 years of opiate avoidance and opioid fear and narcotic fear, all the same thing. The real fear is junkies. And I've talked to enough heroin addicts and they said, Dr. Klein, you just used that word. We give you permission, because that's what they call it themselves, junkies. Because people are really afraid of junkies. And there's a lot of myths about people who are addicted. For example, crime. Turns out that opiate addiction has the lowest crime. Amphetamines, cocaine, methamphetamine, alcohol have the highest rates of crime. They're just normal people that have genetically become addicted to opiates abruptly on their very first pill. So this is quite different than the other addictions. So we'll talk about that later. The assumption about opiates addiction, opioid addiction, is that more pills, more exposure causes more addiction. That's the premise. The question is it true or not? So let's give you some examples of things where people are concerned that more pills cause more addiction. Trumbull County had 28 pharmacies and sold nearly 68 million pills to a population of 209,000, more than 322 pills per every man, woman, and child. They averaged them up and then divided it by the population. What kind of sense does that make? This could be a place where there's a lot of pain clinics, where people take a lot of medicines, high dose, low dose. It doesn't really matter according to the FDA, but a lot of people think high dose is a problem. But for now, let's go with numbers. This is part of what we talked about before of the pharmacy chains. Major thrust of the complaint is that pharmacy chains drag their feet in setting up monitoring protocols at regional distribution centers, enforcing those programs, and raising the threshold for quantity of pills that might otherwise trigger an audit. More pills, more addiction. Here is a story in the New York Times, written by one of their staff writers. My mother's friend is dead now, always the example of those rare people with the disease who die of overdose. Why do they die of overdose? Because the government does not allow them to be treated. The only way to treat an addict is to give them substitution opiate treatment, and every time that happens, the senators come down in hordes to the FDA. No, we're not allowing dopers to be treated with dope. We're just not allowing it. So then they have all these people dying on the street. In Portugal, when they treated all the people with heroin disease, their overdose deaths dropped 80%. There's 100,000 people supposedly dying, according to CDC. We're going to have a session on that too, because that's not true. But anyway, if it were true, it would drop from 100,000 to 20,000 simply by treating people. My friend's mother is dead because of rampant opioid addiction, and it's something no one can ignore anymore. In 1999, 342 Tennesseans died of opioid addiction. That's not solving the problem. That's like saying, we have 55,000 vehicular accidents a year and just leaving it. And normally when you have a problem like this, you say, we have this many vehicular accidents and we are going to start the programs again for airbags and for restraints. Okay, now this one is an article, a very important flub, written by Andrew Kolodny from the Heller School at Brandeis University. The title is 10 Steps the Government Should Take to How to Reverse the Opioid Addiction Epidemic. Not overdose epidemic. They're two different things. So he basically, in this article, goes on and talks about, all this extra opioids in circulation, more drugs, more addiction. But it's not correct. There's no opioid addiction epidemic. The government, SAMHSA, the Substance Abuse and Mental Health Services, goes out every year and collects data. This is the government, and they're collecting data. There's been no increase in addictions to heroin. No increase. As a matter of fact, there's been no increase since 1920. But he makes the mistake. Instead of saying opioid overdose epidemic, he says opioid addiction epidemic. So the U.S. is facing the worst addiction crisis ever. Hey, this is another article in the newspaper. Washington Post. U.S. is facing the worst addiction crisis ever. No? Doesn't anybody check the numbers? You've got a government collecting numbers, right? Check with SAMHSA. Biden must step up his response. So what are they going to do? They're going to try to restrict the pills because they believe that more pills cause more addiction. And guess what? It's not true. Opioid addiction is different than the other addictions. And it's different because it's controlled by genetics. And if it's a genetic disease, that means people that do not have the genetic abnormalities cannot addict to opiates. And we've talked about this a lot, but as my wife says, it's worth repeating. And so we're going to repeat it again. You cannot addict people unless they have the gene, and less than 1/2 of 1% or 2 to 4 people per 1,000 have the abnormalities in their gene that allows the addiction to occur. So all the things that I just read you are false because they didn't check the facts. Thank you and good night.